Yes, sir. And another question is Sandhya ji asks, can you please elaborate on miscarriage management that happens between 5 to 6 weeks of gestation? So, if it is just 5 to 6 weeks, we have to ascertain whether the pregnancy was confirmed. So, let's assume that the pregnancy was confirmed, but within 5 to 6 weeks of gestation, there was miscarriage. Or of the other things like vata management and all, probably the mental health of the lady patient should also be addressed. So, how to go about this, sir?
See, first of all, we need to understand that certain terms in the modern medicine or the Western medicine they use in a very typical manner. Anything which is content of the fertilized thing which goes out of the gestation period, once it is confirmed within a particular period, then they use a term abortion. Miscarriage is a term used, it is the first trimester or at the end of the first trimester after completion of the 12 weeks, something like that. So we need to understand that what is our intention of asking the question. If the intention is that abortion is the intended thing they wanted to ask, then let me clarify. First of all, as you said, we need to confirm there was a pregnancy. That is the first point number one. Then, by evaluating the history, we will come to know that last menstruating period when it was, calculate accordingly. And if you have any supporting document of any primary confirmation or gestational sac or something like that, by scan, if it is there, you just observe that. Then afterwards, if a patient complaining of per vaginal bleed, once there is a confirmed case of pregnancy, then anyhow we have at our disposal, there is ultrasonography. Send the patient for the ultrasonographic scan. Definitely, it gives us an idea whether it is abortion, whether the concept of pregnancy has detached from the thing, internal bleeding, everything. We can very easily catch it by the ultrasonography. Then, if it is already detached, nothing can be done. Evacuation is the only method. Then allow it to go completely. Let it clean the things. Then we need to give garbhashya shodhana dravyas, which will clear the things. So garbhashya shodhana means here once again jiraka, ashoka, that type of drugs should be given that will help to remove the contents or even the rajapravartini because it's already gone. We cannot in any way going to safeguard the pregnancy. Then it has to be cleared. Otherwise, if a partial abortion takes place and the remnant remains inside, there will be continuously bleeding will occur. So that should be taken into consideration. Once that is there, then we need to go for complete evacuation of the fertilization. Once it is cleared, then we need to go for Garbhashya Shodhana Dravyas in the form of Dashamula Kvata or even in the form of Jiraka Garista, Ashoka Rista and such other things. Cleanse it very clearly. Then patient should be advised not to conceive for the next 3 to 4 months. Such type of gap should be maintained. Then accordingly, whatever the treatment has to be given, you initiate if a patient, then you can go for what do you call understanding the history of the patient, whether patient is having any substantially repeated abortions are there. Putragni yoni vapat we call it as. If it is something like that, then it has to be checked out. And if it is not such type of things, then no issues. If it is the first time it has happened, or second time, or third time, multiple times. So all these information definitely help us to plan the protocol, what can be done and what way it should be done. Then we need to go for the strength of the pelvic region, pelvic girdle, and even in the cervical incontinence, they call it as many times in many cases. So such type of things. Then we'll go for yoni pichu, yoni prakshalana, then bastis or something like that. We can be given to improve the health of the pelvic region, including the genitourinary system. And certain gritha can be given like phalagritha or phalasarpi. Such type of things can be given. So which will definitely going to support the pregnancy. Once these things are done, then after the 4 months, then we can advise the patient to have a trial for the pregnancy.
And whenever miscarriage or abortion happens, the couple may be in a hurry to try for the next child. Like you told, giving a gap of 3 to 4 months or even 3 to 6 months is so very important, so that mentally they recover, both the couple, and also the physically, also the general immunity and the overall body nourishment improves, and the uterine health and reproductive health, we can create a better environment, reproductive environment, so that there are better chances of conception and sustained pregnancy and childbirth, like you said.
Definitely, definitely. That is the reason they use it, because once there is an abortion, there will be injury to the musculature inside. It requires a lot of time to get healed and all these things. So once it is, at least a few cycles are required to improve that condition. And of course, when there is a history or twice there is an abortion, then we may have to think of that this patient may go for putragni yoni vapad. Then accordingly, we need to handle her by counseling as well as giving some vata dravyas and improve the pelvic related areas or apana vayu kshetra, that should be properly nourished and maintained, and vata has to be controlled, and these type of concept has to be built in, and make both the couple ready for the next pregnancy after 6 months. A good way of handling their stress as well as improving their bodily nature and improving their bodily strength and efficacy, in order to have the proper pregnancy later on, which can be sustainable till the last day of pregnancy.
Yes, and Deepthi writes, Shilajit is of very light color in Rajasthan, Sindh and Gujarat area. It is called Churiro Bhatto. It is given to women after delivery for sure, but it is consumed in a delicious laddu form, both by men and women, to improve strength and vitality during winter for 6 to 12 weeks. After childbirth, has its uses in women to strengthen the ligaments and the overall strength of the muscles of uterus as well, sir?
It can be. It is a generally balya dravya, rasayana dravya. It can be used in that sense. Of course, it's not be given singly. It will be used in the form of some laddus, and they prepare it. There are a lot of other things to be added. So definitely, in Rajasthan and these areas during winter, it's a very high time for energy consumption. If you are in Rajasthan and Delhi and such type of areas in winter season, you will have a lot of appetite. You are hungry, you will be more, and you will be eating more, because a lot of energy you are losing to maintain the cold. So that's the reason the people will give a lot of other things. Even the even winter they'll use a lot of and even tila, lot of tilpatti, tilaladdu. They will use so many things in the northern India during winters in order to maintain the temperature, proper nourishment as well as temperature, because the energy consumption will be more in the body during those periods.